Do you frequently feel like your heart pains sometimes? Or maybe your child suddenly has a high fever and very red eyes with no cough. These might seem like common issues, but when they come together, they could be signs of something serious called Multisystem Inflammatory Syndrome, MIS, related to COVID-19. It's rare, but it mostly affects children and teens after they've had the coronavirus, even if their first infection was mild or unnoticed. Think of it like a delayed reaction where your body's defense system, instead of calming down, goes into overdrive and starts attacking your own organs. Scary, right? But knowing the signs early can really help. So, what causes this overreaction in the body? It's linked to the COVID-19 virus. Even after the virus is mostly gone, your immune system can go haywire, like a mistaken alarm that keeps blaring after the danger is over. For example, imagine you chased away a burglar, but your security system keeps spraying water everywhere, damaging your own house. This is more likely to happen a few weeks after someone has had COVID-19, especially in kids who didn't even know they were infected. Scientists believe certain kids may have genes or body responses that make them more likely to develop MIS-C, but we're still learning exactly why. How do you know if it is MIS-C? Let us play a quick game. Check if your child has 3 or more of these. High fever for more than 3 days, like thermometer showing over 38.5 degrees Celsius daily. Red and swollen eyes, no dirt in them, just red. Bright red cracked lips. A rash like tiny red dots on the belly or hands. Swollen hands or feet. Belly pain that is serious, like cannot eat or walk. Or feeling very tired. And here is a big one, chest pain or fast heartbeat, like they just ran a race but did not. If your child had a cold or positive COVID test 2 to 4 weeks ago and now shows these signs, do not wait. Call a doctor now. It is not just bad flu, it is a red flag. Diagnosing MIS-C isn't done with a single test. Doctors check symptoms, recent illness, blood tests, to see if there's too much inflammation, and heart scans. Imagine your body is giving clues. Doctors piece them together like a puzzle. They may do an ultrasound of the heart, simple and painless, to check if it's pumping weakly. Treatment, it's fast and strong. Kids often go to the hospital and get IV medicines like IVIG to calm the immune system or steroids. Think of it like putting out a fire in the body before it spreads. Most kids recover well, especially if treated early. Aftercare matters too. Some need follow-up heart checkups to make sure everything's healing. Right now, the best way to prevent MIS-C is to prevent COVID-19 in the first place. Sounds simple, it is. Think of vaccines like body armor. Getting your child vaccinated, even if they've already had COVID, can protect them from severe illness and MIS-C. Also, teach them to wash hands like they're scrubbing off invisible glitter, 20 seconds with soap. Avoid crowded indoor spaces when cases are high, and wear masks if needed. You're not being overprotective, you're being smart. One mom said, "I didn't believe in the vaccine at first, but when my son got MIS-C, I told everyone, get it done." Prevention saves lives. Scientists are learning more every day. Recent studies show that MIS-C cases dropped sharply after vaccines became available. Researchers are also studying why only some kids get it, looking at genes, blood markers, and even past infections. There's a cool new blood test being tested that could spot high risk early. Some hospitals are using telehealth to monitor recovering kids at home safely. And long-term tracking shows most kids heal fully in weeks to months. The message, hope is growing, and knowledge is power. Just like we learned to beat other diseases, we're making progress here too.